and welcome to our MRC Volunteer Orientation. Today, we want you to get a really strong fundamental understanding of what our program is and your role and responsibility in supporting our COVID-19 response efforts. Learn a little bit about our mission, a very brief public health emergency response overview, really going to get into the weeds of your volunteer roles, how to use the Virginia Volunteer Health System, and our online training opportunities. So the Medical Reserve Corps program started after 9/11. We've been around for quite a while. And the reason why we were developed was because at that time, there was no way to organize healthcare professionals that wanted to support in an emergency. There was not a list of people like yourselves who wanted to support the health departments. The federal government required us to develop an emergency system for the advanced registration of volunteer healthcare professionals. For you, that's known as the Virginia Volunteer Health System. Our Medical Reserve Corps program is the volunteer management program for the Virginia Department of Health. We are not a 501c3, we're not Red Cross organization. This is a government managed volunteer program for public health. And within the state, it is sponsored by the Office of Emergency Preparedness, where I am located, but also by our local health districts. The mission of our program is to engage community members in supporting ongoing public health initiatives and emergencies. Volunteers have been doing amazing things long before COVID-19. And this is just our largest response effort ever, but we know even after and before, we still will continue to do great work. And I'm going to give you a few examples. Throughout our communities, we do homeless outreach screenings, healthcare screenings to different underserved populations. We also do drug takebacks to address the opioid epidemic in the southwestern part of the state and across the state. And there are many activities our volunteers are involved in. In Richmond, I believe they even have started back up their STI clinic, and MRC volunteers support that STI clinic. So anything the health department does, MRC volunteers can come along and support. Really, you're our workforce multiplier. In public health emergencies, the Virginia Department of Health has 4 very specific roles. We are responsible for coordinating medical, public health, mental health, and emergency medical services. We do not provide all of those functions. The healthcare systems are responsible for our medical and our private providers. Public health is VDH. Mental health is our Department of Behavioral Health and Developmental Services. And all of our local EMS agencies are networked together and led by our Office of Emergency Medical Services at VDH. Our #1 main mission in this COVID epidemic, pandemic that started in early February, as we started to have individuals returning from other countries to our state, was that we started to conduct active disease surveillance and investigations. And as many of you are aware, we're heavily involved in that at our Office of Epidemiology. Surveillance and investigation has been amazing. All of those numbers that you see on our websites and are shared with everyone is the culmination of so many great people doing a work here at VDH. Our emergency preparedness program is responsible for developing plans and procedures for mass vaccination, mass dispensing of Cipro or Doxy and anthrax attack. Any responsibility to put pills in people's hands or shots in people's arm very, very quickly is one #1 missions of why the MRC was created. Also, we support mass care and shelter operations and provide medical needs in those shelters, first aid, and also providing support to our vulnerable populations within those shelter operations. But let's talk about our task at hand, which is COVID-19. Very early on, our volunteers have been engaged in our response and continue to do so. And although we're turning our attention towards mass vaccination, it will not mean that we will stand down on any of the other public health efforts that we have been doing. Volunteers are virtually and in person supporting contact tracing and epidemiology. We have volunteers that have been staffing call centers, infection prevention, testing clinics, medical surge, and vaccination. I'm going to give you just a couple of examples of those. So we have healthcare providers that have been answering phone calls from healthcare providers. So our MRC volunteers that are healthcare providers have been working with epidemiologists and now the health directors and leadership to answer calls from providers who have questions about testing and vaccinations. Any of the questions are coming into the health department, and our staff are answering them with our MRC volunteer support. Additionally, we have community call centers. So we have many retired nurses, school nurses helping us over the last 8 months, answering calls from the community members. This is some volunteers in Alexandria at a call center there. They staffed that call center for over 7 months now. We also do outreach out in the communities, and that is compiling packages of information, hand sanitizers and masks, hand delivering them door to door in different areas of the community, and also after our testing events. We have volunteers that have been providing public health screening at different buildings, including our local health departments. So we have individuals that are manning the door, making sure that people are coming into our buildings do not have temperatures or been exposed to COVID, trying to maintain operations and keep our workforce safe. There we go. And our MRC volunteers staffed the very first COVID testing event in Henrico County. It was a drive-through testing event, and since then, MRC volunteers have supported over 500 community testing events. It has been an amazing effort from our volunteers. Additionally, we have had many requests for volunteers to support long-term care facilities, especially very early on, although we are still receiving several requests in the northwest part of our state. We have a healthcare workforce shortage. We had a healthcare workforce shortage for long-term care facilities prior to COVID, and it has really hit these facilities very hard. We'll have staff that are sick and they'll have to be quarantined, then and isolated, and then they also infect the residents, and as you know, we have outbreaks, and it is truly a domino effect where we'll have a facility that has sick patients or asymptomatic positive COVID patients, and they're down at least staff by 50% or more. So we do have some requests for volunteers to support long-term care facilities. I just can't even express the amazement that I and others have been humbled by some volunteers in the Eastern region that drove from Newport News all the way to the Eastern Shore to help provide staffing in a long-term care facility that was in a very critical staffing workforce shortage. But as we have gone through and rode through our first peak and really been in the testing phase, we are moving now towards vaccinations. And we have been supporting vaccinations for COVID response, although not COVID vaccine. And in the way of assisting in the gap that we first had early on when schools were back in session, many students had not gotten their school immunizations, and MRC volunteers augmented and worked with the health department to ensure students had their school immunizations. Every year, you may have, oh, it looks like I lost a slide. Okay. You may have been aware that we've been doing drive-through flu vaccination clinics. And those drive-through clinics have been an exercise for us to practice our ability to mass dispense or mass provide vaccinations to the communities. They're disguised as free, come get it, drive through. flu shot clinics, but they are really emergency preparedness exercises. So those models of drive-through vaccination operations are what we're more than likely going to see as we get towards our community vaccination efforts. We are updating this page, the COVID-19 vaccination page, every day with information, just like we do our COVID-19 page. If you want to see where we are with planning, where the vaccine is as far as the dispensing of the vaccine, what the priority groups are, please refer you back to this page because that information will be changing constantly. Hopefully, you will decide to still hang out with us after I'm done with the orientation. Come back and join us at 10:30, where we'll be doing an overview for mass vaccination operations for COVID-19. And we'll really get more into the details of how that vaccine will be distributed throughout the community and how you can be involved in that, what your roles will be, how you'll be assigned those roles. That's what we've been doing, what we're doing now, what we're focusing on. Like I said, that's still contact tracing, public information, case investigation work, testing is still going to continue. And I should have a slide up here. We have provided over 110,000 hours of volunteer support since February. That is well over $3.5 million of volunteer service. And if you ask any public health worker, any VDH staff member, they will tell you there is absolutely, we could not get what we needed to get done for COVID-19 so far without our volunteers. So we are really happy that you've joined our large core of volunteers. But you say, well, why volunteers? Why do you need volunteers? There is, like I mentioned, a limited workforce. Actually, we struggle at the Virginia Department of Health to fill our nursing positions, our public health nursing positions. We have many of our senior nurses who are going to be retiring and we're going to be hiring, and we're struggling to even find workforce to come and join public health. As I mentioned, many of our care facilities have a limited workforce, and we're seeing that, you know, a lot of our workforce is having to stay home because of quarantine and isolation. And that workforce has really shifted over the last 6 months. You know, when we were in phase 1, a lot of people were out of work, so they were volunteering while they could not work. And now some people are working, and now we have students that are a little bit more on the sitting on the sidelines because they're at home right now, so that they're volunteering, and they were very active during the summer. So who is supporting us will vary based upon availability, based upon what skills we are looking for. Maybe you have joined us this morning because you received an email from Dr. Oliver, our state health commissioner, making a call out for volunteers to help support our vaccination response efforts. If you did, thank you for reading his email and joining us this morning. Obviously, you joined us because you care. And I think that more than anything, who we need is individuals that care about their community and want to see their community be healthier and want to see this pandemic end. I think that all of us that are spending time this morning doing that really have that in our heart. We do need to quickly expand capacity, and sometimes that capacity needs to expand so quickly that we don't have the ability to hire people quick enough. And so volunteers can step in and really quickly, for a couple days, fill in gaps where we couldn't hire people, or even there's not even contractors to hire to fill the positions. And we need both support and medical volunteers. So for healthcare professionals, we welcome any type of healthcare professional. We have one of everything and above and more. And our largest group of volunteers are nurses, so our RNs, LPNs, nurse practitioners. We have over 2,800 nurses in the MRC. Now, next week, that'll change greatly as we go on approving applications, but We are really focused on recruiting healthcare professionals that can help us provide clinical testing, maybe even augmenting our hospitals if they're short-staffed as well, and helping us to provide vaccinations out in the community. Those vaccinations cannot be done. The testing events cannot go on successfully without some non-medical volunteer support. And that includes teachers to help welcome and greet people, social workers that can help individuals work through paperwork or answer questions. We really need interpreters. Our services, what we do at the Virginia Department of Health, we focused on underserved populations. So really our target care that we're providing that we'll be focusing on in public health is going to be those underserved communities. And many of them are ones that are English as a second language, that speak Spanish, that might have, and we even looking at developing a state interpretation response team that can support contact tracing. We've needed interpreters that could assist us with Nepali interpretation and I think Arabic. So there are a lot of different community members that we need to be able to communicate with. So if you can speak another language, please let us know. We'd love for you to enjoy that team. We have something for everyone to do. And if, like I said, you have a good heart and you're willing to help public health, then you're in the right place. You're also joining a large group of volunteers. I actually ran numbers this morning really quick. We have over right now 12,481 deployable volunteers, and that means we have volunteers that have completed an orientation, they've completed a background investigation, that have an identification badge. We know who you are, we know your license, we know what your qualifications are, and we can notify you and deploy you out if you're needed. And we want to be able to do that quickly. We've been trying to do that I just got an email. Why are you just sending this email out about needing vaccinators? Well, we put a call out for volunteers in March, and we processed over 8,000 applications. But those 8,000 applications were not all for medical volunteers, and we received a lot of support volunteer applications. And so this round, the soft kind of targeted recruitment strategy that we're implementing right now is very much focused on healthcare providers. So these numbers have increased by 60%. So we've increased our deployable volunteers by 60% since January. That's absolutely phenomenal. And there are a lot of red shirts throughout the state. You're joining a really wonderful team of volunteers. I know you'll get the opportunity to meet some of your community members as you're engaged and you work some of our response efforts. Here's the one piece of homework that I really want you all to write down for me if you have a sheet of paper. Who your MRC Unit Coordinator is. So I'm going to go around the state. If you're in Loudoun County, your MRC Unit Coordinator is Francis Rath, and he has an assistant, Monsi. Fairfax is Paula Rosca. Arlington is Christina. In Alexandria, we have Ianella. Prince William is Amy. Henrico and Chickahominy is Alyssa. Three Rivers is Johanna. Eastern Shore is Ellen Archer, Peninsula, Olivia, Norfolk, Summer, Portsmouth is Terry, Virginia Beach is Ellen Burgess, Chesapeake is Tom, Western Tidewater is Connor, Richmond City is Kate, although Kate and Alyssa and Henrico and Richmond City, they tag team, so you might hear from both of them. Chesterfield is Augustine. South Central, actually, Katrina is no longer with us, but your point of contact will probably be Tanisha Short. And actually, oh, I forgot to introduce Tanisha. Tanisha is in the chat box today. So she is our Central Region MRC Program Coordinator. She's our Assistant Coordinator. She supports all of the MRC units in that region. So you may be hearing from her. She's in the chat box. And if I don't answer a question, perhaps as we go throughout the training, please feel free to put it in the chat box and she'd be happy to answer it. Well, I'll answer it at the end, or she'll provide the link and answer the information for you in the chat box. Sorry about that, Tanisha. We have in Northwest region, Chris Rainey, and near Southwest is Mary Lou, and the far Southwest is Christina Morris. You might also be hearing from Pat as well. So know who your coordinators are. You'll be receiving alert communications from them or one of their assistant coordinators. As you can imagine, increasing our volunteer capacity by 60% has been a workforce undertaking into itself. So a lot of our MRC unit coordinators have now assistant coordinators, and actually at the central office, I'm very blessed to have a wonderful team. You might be hearing from Laura or Will, Carrie. We have several people that help with training. Actually, Adrenia is on. You might have received the training alert from her. So we have a team at the central office as well, and you have a point of contact at the local office. So I do need to go over, I'm not sure what happened to those bullet points. All right. Need to go over our expectations for our MRC volunteers. One, do not self-deploy. Just because you see in the news that we are doing vaccinations at a church does not mean that we need you there. So please don't go and show up unless you receive an alert and we ask you to. Complete the training. You're completing the orientation. I'm going to go over a little bit about training in a few slides. Respond to our alert notifications. Be dependable. If you say that you're going to show up, please show up. If you can't, please let us know so that we can reschedule you, find someone to fill in your position. Maintain current contact information. As you can imagine, you have a cell phone and you have a contact list on your cell phone, right? Maybe you have 200 people on that contact list. We have 17,000 people on our contact list. Please help us manage our contact list by updating your information. And I'm going to show you how to do that. Really, our kind of requirement is that you have a commitment to help us when you're available, and that when you do respond, you really take on a very important role of representing the Medical Reserve Corps and the Virginia Department of Health. So let me reiterate, do not respond unless we ask you to. If you do self-deploy without our deployment instructions, without providing you with deployment instructions, we will have to remove you as a member of the MRC. So you will be held liable for any actions if you're not being deployed, and we want you to stay safe. And much of the reason why we want you not to deploy is because sometimes, not necessarily right now for COVID, but such in the case when we have hurricanes and tornadoes and such, that, you know, we don't want you to go into an area that is not safe. So please wait, follow for instructions. We ask that you represent the MRC when you're asked to. So we are more than happy to facilitate interviews with volunteers with the media, but it has to be done through a public information officer or your MRC unit coordinator. So if you are approached by the media, please let us know. We can facilitate that. When in doubt, always ask. We have had volunteers on national I think it was Dateline NBC, Fox News. The Medical Reserve Corps program in Virginia has never received so much media attention. I think I have 2 interviews scheduled next week. So, and you might be asked to be a part of one of those interviews. So just please ask, and we'll be happy to provide you with talking points and some guidance. For HIPAA, so to protect health information of our patients and clients, we follow all of the Health Information Portability and Accountability Act, which requires VDH personnel to secure the information of patients and clients. It is all confidential. Even that someone came to a point of vaccination clinic is in fact a one of those identifiable information. So we don't even share that. I'd ask that when you completed your application, if you have not completed it yet, you will be asked to review our HIPAA acknowledgement form and liability acknowledgement form in your application. At the orientation landing page that Tanisha can put in the chat box, You can download that liability and HIPAA acknowledgement form. We ask that you definitely review that and make sure that you understand all that. I'm sure all of us are aware what HIPAA is, and those of you that have been healthcare providers, you've obviously received lots of training. So I think I don't need to reinforce those concepts any further. Thankfully, as a member of the Medical Reserve Corps, you volunteers receive the same liability coverage as any Commonwealth of Virginia employee. So you have that same coverage. It is in code. I have provided here our website, which lists all of the legal coverage available to volunteers. We are making, and it's not necessarily liability coverage, although I expect that we're going to get a standing liability coverage for our COVID vaccine administration. I expect that we might see that sometime next week from the governor's office. But we are looking at expanding executive orders and other things to make sure that we have the appropriate protection for our volunteer staff, EMS, healthcare providers that are supporting us with our vaccination efforts for COVID-19. So you maintaining information safely about our patients and clients, but we also take that very seriously for you. Your information is managed by our Medical Reserve Corps coordinators, our staff in the Office of Emergency Preparedness, public health emergency coordinators, myself, anybody that needs to have access to your information. We do have volunteers that help us to document deployments. So they might be entering information in your volunteer profile to assist the MRC Unit Coordinators. So that is also someone who may have access. Now, when you registered, you agreed to allow us to share information as necessary for your deployment. So if you say, yes, I'm going to deploy, I'm willing to support this effort, then we're going to export a sheet that includes your emergency contact information, your license number, the fact that you have CPR certifications, the fact that you have passed a background investigation. We're going to provide all that information in an Excel spreadsheet to the supervisor that will be supervising you to ensure that they understand your credentials, and that if something were to happen to you, they can contact your emergency contact. So that is how we exchange that information, and primarily that's what we provide to other partners. You can also download your information out of the Virginia Volunteer Health System and provide it to anyone that you would like to provide it to. Perhaps that's to an employer or your program, your nursing program, or medical school, whatever the need is. We can show you how to do that as well. And all that information is stored in our Virginia Volunteer Health System. So the Virginia Volunteer Health System is web-based. We use it for alerting and credentialing, tracking of volunteers. It is the powerhouse behind everything that we do in Virginia for Medical Reserve Corps. VDHS can be accessed on your phone. The screen may not fit on your phone as nicely as it does on the computer screen, but if you collapse the menu on the left, you can navigate your account in VDHS using your phone. Now, you should all be familiar with this screen. Actually, maybe you got the letter from the commissioner and you haven't even gotten to the portion of completing or filling out the application. So if you haven't completed an application, you're going to go register as a new volunteer. If you have created an account and you just haven't submitted it and completed your application, then, and you know what your username and password is, then you're going to come over here and sign in. So make sure that do not create another account. If you have problems logging in, you can click on the trouble logging in button, and that will take you and allow you to reset your password and find out what your username is. And then if you have any problems, you can come down to contact us, and that'll send you to the VA MRC email. Please send us an email. Carrie, our application manager, would be more than happy to help you access your application and fill out any information for you. When you log into your account in the Virginia Volunteer Health System, you have the ability to see information. You can see your alerts in VDHS, your deployments and training, so you can export that information. But what I want to show you how to manage for us is your contact information. You can do that by going to the My Account button, or right here where it says My Account. You click that button and it's going to look very familiar to what your application looked like when you submitted all your information. So you're going to see a summary page, and if you come over to the Contact Us, or the Contact Information tab, you click on that link, it's going to take you to all the contact information that you entered. So I have over here an arrow. Everywhere in the application where you see the pencil and the edit, and it's okay. I'm unmuted now. Okay, I was muted. It looks like I'm unmuted. Mary Jane Timmerman, can you do me a favor? Can you give me a thumbs up if you can hear me? Or Nan or Catherine, just show me a thumbs up if you can hear me. Yay, thank you, Nan. She got to it. Good, thank you. Appreciate it. Good to have a double check on that. So anywhere in the application where you can change information that you entered, you just use the edit button. When you click that edit button, it's going to open up your application. Now, this would be editing information for Zeus Freeland, who is my buddy. And I'm using his information so that you can see how you can make edits to it. You can come in here and if you want to add a secondary email, I encourage you that if you're using an .edu or a .gov email, that you really use a Gmail, Yahoo, or some other type of email, especially if you're a student. If you're a student, please put a backup email. Some of those government servers will actually block emails coming from our system, just because we send so many emails. So having a secondary email is really great. We also send text messages and phone calls as a backup, so that's okay as well. Now, I put in here some examples of pictures. This is Zeus, and Zeus is a therapy dog, and we want to give Zeus a badge. And you have the opportunity to select which picture you would like on your identification badge. And we ask that you pick one that is the most appropriate. So what is not appropriate is to have yourself and your adorable niece or child in your picture. We want a straight head-on shot that doesn't have anything in the background, so it has a solid background. And then, so if I come all the way over here to the right, you'll see Zeus's head on and with a solid background, and that's a picture that you would want to upload into the Virginia Volunteer Health System. So if you have not done that, please go and have a family member take a picture of you in front of a wall and upload that into your account, and that'll be the picture that we use to create your badge. This significantly helps us when mass producing background badges. As you can imagine, we're going to probably be sending out over 600 badges in the next 2 weeks. So do us a favor and help us in updating your picture. You can also make sure that you are receiving your alert notifications to the appropriate phones. And this section, phone and text alert, is where you make changes to that. If you have a phone that you can receive text messages on, highly recommend that you choose the option to receive both phone and text messages. Now, you don't want text messages going to your home phone, perhaps, if you still have a home phone, so make sure you choose phone only. You can use as many phones listed here as you want, or you can just choose your primary cell, which is what most people do. In our identification area in VDHS and in the CPR and license information, you have the option, and we really would ask that you upload an identification document. So this might be a driver's license. Everybody's scratching all over the screen. It's right there underneath the black lines. You can hit the change or remove or add button there to be able to upload your pictures. And If you are a vaccinator or a healthcare provider, we definitely need you to document your certification. So please choose your certification type and the issuing organization. You can also upload a copy. Now, a copy, it could be a picture that you take on your phone. It doesn't necessarily have to be a scanned copy, just something that helps us identify who you are and what your qualifications are. If you give us a good headshot and a copy of some type of identification for you, we're able to conduct your background investigations without further contacting you. So that also helps us get through one additional hurdle in making you a deployable volunteer. All right, that's all the credentialing, contact information stuff that you have to have in VDHS. So let's get that administrative stuff off the table and focus on preparing you to respond. Now, we're in a little, started towards a phase of what I would call just-in-time training. We have been, of course, onboarding and training volunteers for many years. I actually started as the MRC Unit Coordinator in Suffolk 16 years ago, started training volunteers. But we're at this kind of crunch time, so some of our training looks a little different. We do have a really robust learning management system. Some of your training might be housed on this learning management system, and we ask that you log in and take training using the system when it also comes over and you're able to see it in the Virginia Volunteer Health System. So this is the address, but the Virginia Volunteer Health System will create a train account for you 24 hours after your VDHS account is approved. And so don't go and create an account because we're creating one for you. And this is the website for Train. And then we also, I'm going to share it on the next screen, have a website that you can go to for understanding MRC training. But what's really awesome about Train is that it is just a wealth of courses from CDC, from FEMA, NIH, public health. I mean, it is just the master library of public health training. Our training for the different COVID vaccines probably will all be online, and it will be housed in the Virginia train. So I'm going to go. So there will be, other than orientation, some additional training for you to complete. And that's going to be dependent upon what role that you are going to be serving, or you'll be serving in this response. So our contact tracers, there's specific training that contact tracers have to have. Testing, individuals that are doing testing, there's specific training for them. There is some public information training. So it's all specific to what role you're assigned. Vaccinators, there is specific training for vaccinators. There's specific training if you want to do flu, and there's training if you want to do COVID, and we're waiting for some of that training to come out. But we are encouraging any volunteer that is going to be supporting our mass vaccination efforts to complete a point of dispensing overview or a vaccination operation overview. There is an online option for that. We call that a point of dispensing, a point of vaccination. We have online training and also the live training here at 10:30. There is an incident command system overview. We're going to be teaching that in a couple of weeks in a similar format. If you are a healthcare provider and you do not have a current CPR certification, we have scholarships available for you to complete the didactic portion of the American Heart Association Healthcare Provider CPR certification. So we will put that, a link to the scholarship, in the chat box. And also when your account is approved, we will make sure that you get access to that as well. It is online training separate through the American Heart Association. Your local MRC unit might have some specific training that they need you to take, and you might be getting training the day of when you show up. If you haven't had the training that you needed, we'll provide what's called just-in-time training. So might be 30 minutes before the vaccination clinic starts. It might be an hour before the vaccination clinic starts. We will make sure that you have the appropriate training for the roles that you are assigned. because we want you to be safe and we want our clients to be safe as well. Oh, looks like we have some typing. Okay, I'm going to keep moving along. This is in VDHS. It has your information for train. Yeah, thanks, Veronica, for removing that for me. So you can go to your training tab in VDHS in your account, and it'll list all the trainings that you've completed. It'll tell you which MRC unit you've been assigned to. It'll give you your train user ID. So all that comes over. A FEMA student ID is not required. If you're really into emergency management and you think that that is a career path that you want to take, there's a lot of courses offered by FEMA. So getting a student ID number would probably be very helpful for you. That is training. So how do you go from being registered to being approved to completing training to being mobilized? And that is what we consider to be the activation phase of our volunteer management process. We send communications through the Virginia Volunteer Health System, and they have different alert classifications. So we send communication alerts, and typically those are FYI, a newsletter. This is what's going on. Hey, remember it's it's National Preparedness Month. Awareness might be sent when we think that we know that the hurricane is 2 weeks away and we are wanting you to be prepared. So we might send a heads up awareness email. Readiness is we need to know if you are available. So we are sending out alerts to our healthcare providers and asking them if you're available to support mass vaccination efforts, if you want to support testing. So we're trying to ready up and develop our different teams of volunteers to support different response efforts. Once you're on that team, we will say, you are needed now, please show up. And here's what we need you to do. And if you can show up at this date and this time and this location, you're going to let us know. We will send emergency alerts when we need a response in less than 24 to 48 hours. Typically, all emergency response come out via email, phone, and text message. And then deactivation. It might be a long time before we send a deactivation alert in VVHS, but often when we've ramped up for a potential hurricane response and they decide not to set up the shelter, we'll send a deactivation alert to let everyone know. When you receive an alert from the Virginia Volunteer Health System, it's going to say VVHS training or VVHS activation, and then there'll be the specific subject line. There will be a short summary of what the event is or the activation training is about. You can see here, Kate was asking some volunteers to provide some health screening and health education to individuals that were attending the Special Olympics in Richmond. And so that's something that we do. And so if you were interested in supporting that and learning more, you would click on that link that says, please click here to confirm receipt and select your availability. So that will come as a pop-up, and in that pop-up is information that is specific to you. This is a response screen that's been created that connects to you individually in the Virginia Volunteer Health System. Typically, you will see a who, what, when, where, how format and additional information. That's the template that we use for providing and asking for volunteers. And if you read through this and you say, oh yes, I haven't completed that course, then you can come down and click the I'm available to attend that training button, or I'm not available to attend. So either the blue or the red button. This is what it will look like if there's only one option to respond. If a coordinator is, say, setting up vaccination clinics for an entire week, and there's going to be 5 of them for an entire week in 3 different locations with different shifts and times, then you will probably see an alert that has multiple choices. So you would be able to come and click available if you are available to go to T.C. Williams High School. If you also can go to Alexandria Elementary, you can click at available, and then you can choose I'm available for the selected events. If you're not available for any of them, then you would say I'm not available for any of the events. So we'll have those multiple options. Now, some unit coordinators are also using Sign Up Genius. So you may get a link that asks you to sign up using Sign Up Genius because they're partnering with other organizations. For events that are ongoing, some unit coordinators are using Sign Up Genius, and that'll just be a different link in the alert for you to be able to respond. So other than email, we send phone messages. So if you have your cell phone in front of you, which I would be really surprised if somebody did not have a cell phone in front of them, today's dates and way we are, I would like for you to either write down or type into your phone our phone number. So put this in our contact list so you don't go, oh my gosh, that is one of those crank calls again. No, this is our phone number, 804-864-7200. So save that as MRC alert. And when you get a phone call, you're going to pick up the phone. And if it gives you the option to respond, it'll say, if you are available for this alert, please select 1. If you're not available, please select 2. Or it might say, to indicate your availability, please check your email. So we can't capture the multiple options via phone. So it's going to ask you to go back to email. We will always send an email with a text message and a text message with an email. So if you get the text message and you don't get the email, please contact your unit coordinator. We can troubleshoot that and make sure that your response gets recorded appropriately. So that's how you tell us you're available. Now, I know many of you want to be available or else you wouldn't be spending time with me on a Saturday morning. We want individuals to say they're available when they're qualified for the positions that we're asking to be filled. So if you're not a nurse, don't sign up to be a nurse. We want you to be personally, physically, and emotionally ready. So please review the alert. If it's for a long day, so for example, in addition to COVID response, it looks like we're going to be sending 30 healthcare professionals to the inauguration to provide medical support in medical tents on the National Mall for the actual inauguration. And that is a long day. It is a 12-hour day. It requires a lot of walking and standing. You know, you might be perfectly capable of doing 6 hours at a vaccination event where, you know, you can sit down and stand up, move around, but, you know, 12 hours on your feet may not be the right fit for you. So please make sure you look at the alert, you look at the duration of the alert to make sure that you physically can do that. And some people say, I can't sit for long periods of time. Well, at a mass vaccination clinic, there's plenty of positions that require, you know, if we're doing drive-through, just taking paper and writing down information from people, and you can stand and walk, which a lot of us who have been sitting for a long period of time, like myself, would love to be walking around for a couple hours. So please make sure when you say you're available, you're physically available, you're in the right state of mind, you're not stressed out, and that you can make the commitment and that you're qualified to do so. Understand that we are in the times of COVID-19 and this pandemic, and although the vaccine is here and it's in some hospitals ready to go, and I think probably we've gotten approval by now, maybe this morning, I haven't checked, probably be giving COVID vaccinations maybe as early as tomorrow. Knowing that, you know, some individuals at higher risk, so if you're older, you have health issues, or you live with someone that does, it may not be the appropriate time for you to go and interact with the public. However, I mentioned earlier, we still have lots of roles that need to be done that actually are not public facing or have potential exposure to individuals with COVID, as long as you're following the CDC infection prevention strategies and recommendations. So, maybe that's answering the phone, or it's doing contact tracing at home until we can get everyone vaccinated. Always wear the appropriate were issued. N95 masks require a fit testing. An N95 mask put on your face does not mean you have an N95 mask that works. N95 masks are like a pair of shoes, and you have to make sure that they fit. We will provide fit testing to volunteers if they have if they need to wear an N95 mask. Now, when you filled out your application in the Virginia Volunteer Health System, if you've already done that and you've been fitted with an N95 mask, please make sure that you note that. If you're able to do fit testing, you've been trained to do fit testing for N95, please make sure you do that. We actually have volunteers that have been going to long-term care facilities, providing fit testing to the healthcare workers at long-term care facilities, and fire and police, and I mean, just everywhere. We have had a large contingent of volunteers working with fit testing. Please make sure you consult your employer, share with them if you are employed what you're doing. And if they say, hey, that's too risky, I don't want you to do that, we definitely don't want you to jeopardize your employment. And you can choose always to serve in lower risk positions. Even when we do our drive-through testing events, there's people that do logistics that don't even come anywhere close to the cars that are driving through. So please share that information with us so we can make sure that we keep you safe and healthy. That is our #1 priority. We are, I don't have it in the slides, but Megan and Lean will probably mention in the next training if you're attending, that we are MRC volunteers that have a public face and will be interacting with potential COVID, be exposed to potential COVID individuals. So doing the testing, doing our vaccination clinics, having that one-on-one interaction, and their healthcare providers, you are considered 1A. So we will have closed point of vaccinations clinics, and you as MRC volunteers will be invited to come and get vaccinated if you would like to do so at that time. So we will put you in the fast line if you're going to be supporting our testing or vaccination efforts. You will want to go when you said you're available, but understand that you are a volunteer, and it really is up to you to decide if you're available and the right person to participate in whatever deployment you're asking to support. Always remember that you represent the Medical Reserve Corps and the Virginia Department of Health. You'll be issued an ID badge. Always wear your ID badge. We do have Virginia MRC t-shirts. Well, obviously we're going into winter. Some MRC units are looking at sweat jackets. Many of them are going to have vests that you can put over clothing. Of course, if we're indoors and you want to wear your Virginia MRC shirt with a long sleeve shirt underneath of it, you're more than welcome to do that. We're actually in the process of ordering some more warmer weather identification apparel. So we'll see what we have here in another couple of weeks. We want you to follow the directions and instructions. Please make sure you sign in and sign out, not only to document your hours, but because we want to make sure you're safe, and we want to know that we know where you are. And if you're not there anymore, that we can say, okay, well, they had to leave, or where are they? We are accountable for your well-being, so please let us know when you have left. We may be deploying volunteers into healthcare facilities. We have gotten a request by one healthcare system to have MRC volunteers to support COVID vaccinations and COVID testing with the healthcare system. So we might be deploying volunteers to a facility, a long-term care facility or healthcare facility, and you'll actually be supervised by that facility, not necessarily by the health department. If that's the case, they will have a document for you to sign in and sign out. Please make sure you do that. We also will send post-deployment emails asking for you to complete surveys to let us know, did everything go well? Did you feel prepared? all of that. So we can learn and we can constantly improve our ability to mobilize qualified volunteers to support the response overall. You'll be provided with job action sheets. So these are kind of job descriptions. And if it's something that you haven't done before, they will provide you on-site training. So any of our volunteers that are going to be going and helping the hospitals, potentially in the health systems, give COVID vaccinations, you will be provided with all of the just-in-time training by those facilities. We'll see where that is. We plan possibly for that occur. We don't know if it's going to occur, but there's some indicators that that might happen. And always wear the appropriate and the fit tested PPE. I think I already talked about that. If there's one thing that we absolutely know, without a doubt, things will change. And things change constantly. And in our world, in emergency preparedness, things change with one click of an email. And so we are a hurry up and ready, wait, posture, get prepared mode. And we've been doing that along with responding all throughout this, but constantly having to anticipate what we need now, and what we're going to need 2 weeks from now, and trying to meet those needs. So we're hurrying up, getting the vaccine in the doors right now, and we have clinics being scheduled by some of the local health departments in 2 to 3 weeks. I said that looks like the vaccine was going to get here before Santa, and certainly it has. So we are incredibly thankful for that. And know that this work, it is very, very, very rewarding, but it is stressful at times. We're all living in a very stressful time, regardless if you're volunteering or not. I think we all have a little bit of COVID fatigue, but just be flexible and understand that we're all doing the best we can. Communication might change. We might say we're going to one place, and for some reason they say we can't go there anymore, and then we have to change plans and go to a church instead of a school. Things like that will happen, and we just have to be flexible. So here are the things that we really need for you to remember. Do not forget that you represent the Virginia Department of Health and the Medical Reserve Corps. You will be activated when you are needed. So if maybe you and your husband or your daughter or a colleague are all members of the MRC, maybe one lives in Fredericksburg and the other one lives in Manassas, and your daughter lives in Suffolk in Hampton Roads area, and all of you get different alerts. One of you doesn't get one and the other one does, and this one at this day. We send alert communications specifically to the people we need where they're needed. So we're constantly sending alerts to volunteers. Usually during an orientation, typically we'll have 2 to 3 alert communications go out requesting for volunteers. We are constantly mobilizing volunteers. There are volunteers out in the community working today. So respond to the alerts. Let us know if you can come or not. If you don't let us know, the coordinators do have a button in the Virginia Volunteer Health System that they can click that says, please send an alert to people that don't respond. So respond either available or not available, or else you might get the alert again. So just let us know. Only talk to the media if it's coordinated by your MRC Unit Coordinator or the Public Information Officer. We will create a train account for you, and the information to how do you log in is provided on our website, and we really need you to stand by for deployment. So we've gone through the core of our orientation. Now it's a much more compressed. I did that in almost an hour, and typically it's a 2-hour orientation. Our next steps is that you get an approved application. So if you attended orientation, you haven't finished your application, you have questions, you can send an email to VA MRC. and Carrie, our application manager, will help you. We'll be conducting your background investigation. If we don't have the information that we need in the Virginia Volunteer Health System, we might be contacting you to get that information that's needed to conduct your background investigation. Have your picture uploaded. We're going to get badges batched out and printed. Probably be sending those out at the end of the week. Complete the online training and the CPR certification. If you don't have it, put in that scholarship to get CPR completed, and stand by for mobilization and for demobilization. If you have any questions about instructions that you've received, or any questions after you've deployed, or issues, please contact your MRC Unit Coordinator or their assistant, and they'd be more than happy to answer your questions and make sure that you have a wonderful volunteer experience, and you're able to serve your community. It is an honor and to manage this program, to see how we've increased the number of available volunteers by 60%, probably over 70% by now. It's amazing, truly amazing. And us at VDH and Public Health, as you can imagine, have been working really hard for a long period of time in this COVID response. When we sent that letter out from Dr. Oliver sent the letter out on Friday to healthcare providers, when the governor made a call for MRC volunteers, for community members to join the MRC. We never in our wildest dreams would have expected that the response from the community is so positive. Truly, Virginia is for volunteers, and it's amazing what we've been able to accomplish, but our largest response effort is yet ahead of us. And for us in the vaccination unit, really in planning, and I'm also a member of the healthcare workforce committee. And, you know, we see a little bit in the deer in the headlights. We're like, the vaccine's getting here. We have to do it twice. We need more people. And we sent that alert out, and to have nearly 2,000 applications in less than 24 hours is just an amazing response. And to have over 700 people in this orientation this morning is phenomenal. So from our leadership, from the command staff at VDH, I just can't tell you how that makes us be able to rest a little easier knowing that you are coming alongside us and helping us. So thank you for serving and supporting us at VDH, and for supporting and protecting the health of your community. I have ask that Tanisha kind of take some notes of some questions that were in the chat box. Please don't leave yet. Don't go anywhere. We need to know that you are here. So you can go to the orientation webpage, and in the orientation webpage, there is a link that says click here to document that you attended orientation. So we want you to go there and fill out the form. Now, the secret code is VA MRC Rocks. So VA MRC Rocks is the secret phrase that you're going to put in your form when you fill it out. VA MRC Rocks. And I'm sure Tanisha, and if you know that word, that phrase, everybody type it in the chat box, because everybody's going to ask me, what was that phrase? Put it in there, VA MRC Rocks. That goes, that will be the secret phrase that you'll put in to be able to document your attendance. Tanisha, I have just a few minutes. I will take some questions. For those of you that are going to continue with us and complete the pod training, the COVID vaccination overview training, we are going to actually close this session, take a 10-minute break, and then we'll be reopening the other session. So you're going to log off, and then you'll click this link and just come back to the next session and be opened up into a different room that we'll provide that training. So we're going to close it, and then we'll open it back up. Before we do that, Tanisha, are there any questions that were asked that maybe I can answer, or maybe we can answer in chat later?
Yes, can you clarify a PPE? is provided or not provided, or why it's not provided, and clarify fit testing?
Sure. PPE is absolutely provided. Absolutely. We will not deploy. So PPE is gloves, gowns, face shield, N95 masks. And long-term care facilities, it's even food, foot coverings, hair coverings. All of that is provided. Absolutely. We will fit test you with an N95 mask that fits your face. We will provide you with an N95 mask. If we cannot find an N95 mask that fits your face appropriately, you will not be sent for that deployment. At one point in time, we had a shortage on size small N95 masks, but I think that has been resolved. You know, as you know, there's been supply chain management with our PPE availability, but things are pretty solid right now. So that is our personal protective equipment, and it'll be assigned to you according to your position and according to risk. So people that are doing the swabbing at a testing event are in full PPE. Even if you see National Guard, they're in zip-up suits, full suits. Whereas the people at the front of the line that are talking to people through the window, that are not collecting, everybody's wearing masks, they're not wearing full PPE. So it's dependent upon your risk and exposure and what position you're in. That'll determine what PPE you're being issued.
Okay, ALS and CPR, the link was provided if they need to complete a scholarship opportunity.
Correct. And so we're doing the online version. We don't have as much capacity as you can imagine right now to do the hands-on skill portion of CPR. Based on percent positivity, space, and availability of staff, we were determining if hands-on skill assessment can be provided. That'll be up to the MRC unit. I imagine where we are right now, we probably will not be doing a lot of hands-on skills assessments. And that can be done at a later date. And once it's done at a later date, you'll be issued your final card, but you will get a temporary didactic certification card.
Okay, and CEUs for this orientation or the COVID-19 mass vaccination overview?
We don't have CEUs. Some of the Board of Nursing and actually the Department of Education is providing contact hours for school nurses. It really varies. A lot of, I imagine a lot of the vaccination, the online vaccination courses do have CEUs, I believe, for nursing. It really varies, and we're working to try to offer more credits. I'm working with all of the boards so that they can give MRC volunteers credits for the training that they are receiving.
Okay, that's it. That's all I have.
Great, thank you everyone. So go grab some coffee, take a restroom break, and come back and join us at 10:30. Thank you for joining me this morning. Have a good one.